One of my least favorite things to do is to read over documentations from specialists, ER records, or other files that come to us every day. Again, tons of homework to try to go through. And we do it, and I do it because I'm trying to make sure I have the best picture of what's going on with my patient. And with ICD-10 codes and trying to keep the patient's best picture painted, especially if you're in a risk-based contract, it's very important, but it's very time consuming. The other thing that is very time consuming, but again, super important to understand, is when a patient gets hospitalized, what the plan of what happened during the stay is coming out. I reached out to NeuroWave to see if they could help make this much easier to create a kind of a one-page summary, and they absolutely already had that done. It was amazing taking a specialist note to break it down to all the key factors, but also pulling out the ICD-10 codes, which in some cases, the actual hospital note or the ER note or the specialist note didn't specify because they just put a very broad statement without actually the proper ICD-10 code. And that's a huge time consumer in making sure that everything's there. Now, a really great feature of it is you can batch all these different patients into it all at once. Or as what we do for hospital records, you have a hospital record that's made up of labs, images, the initial hospital ER record, the hospital discharge summary. You can combine all those things and actually have it combine all these different files into one to give a really concise story so that me as a doctor can know what happened very quickly. And my favorite story of using that when we first started using it is we had this patient that went to the ER and was for an infection. And they went and they came back and we threw all this stuff through NeuroWave and it came up with like two completely different sets of diagnosis codes, which was very confusing to myself and my staff. And we're like, AI is not as good as we thought it was. And then I started reading down because again, this is the first time it's ever made anywhere close to a mistake. And when I started reading it down is what happened was we actually interpreted and mislabeled this person's records. What happened was the person went 2 separate days, 2 days in a row for the first reason, and then that had a complication and went back for a second reason related to the first. And why we just assumed it was all a continuation, the NeuroWave AI was able to identify that it was two completely different things, and thus the reason why it had two different ICD-10 codes, two different sets of documentation, which then made me laugh because then I realized that there's probably tons of other times where we as humans, we let little things slip or make a mistake, such as dates and everything, especially when we're trying to do so much data and so quickly that little things can be missed. And using NeuroWave to cut down mistakes, saves time, makes everything much easier, and it's just much safer and better for the patients.